I'm Shelley Kozel. I've got 28 years of physical therapy experience. I'm a pediatric specialist and I'm an inpatient rehab manager. We've been trialing this product for the last 90 days and it's really been a lot of fun to work with. It's got a higher high-low range than most tables. So if I have a very large patient and I'm trying to get them off the Barton chair or some of the other devices we have, usually there's a little drop in between the two surfaces. This one comes all the way up to the height of that Barton chair. A backrest for working on sitting balance and give them a little back support, let them rest when they need to. When I want to work done sit to stand, this is what I do. Pull it back against the knees. I've got a nice knee block and I've got that calf block behind so the patient's not going to go into flexion and come off of the table or fall. Okay. And they can work sit to stand in their standing balance. I can change that height and change where I'm giving the support for the patient. So I can bring it all the way up if I want. And it's going to give them support all the way up to the waist. Or I can bring it down and they've just got the knee block. So I have different levels of assistance for the patient. So we've been doing slide transfers. We might put one bar up so the person's got something to pull to. And then have them slide transfer on and work on their slide transfer. And we can match this really nicely to the patient's wheelchair height, even if it's at different heights. And that's been helpful. They've added a couple little tricks. Got a little hook. It's magnetic for so catheter bags and little things you want to hang up. I've had patients working their trunk control and sitting balance. If I have a patient that tends to that blood pressure drop on them, I can lay them back if I need to fairly quickly. The heaviest patient that we put on it, we put 375 on ours. So we got it right after our 475 are left. So we haven't tried that. But we put 375 on it and a small therapist and a large therapist. Patients are loving it. They are feeling safe. If you get in here, you just feel surrounded. So they do feel safe. The therapists are having more guts about doing more standing activities with that patient that's a little borderline. You know, so I have some inexperienced therapists. They get in there and they start working this and they go, oh, I can do that. You know, they feel safe. And then they can take them to that next level because once you've got them standing up, you know, it's much easier to walk than it is to stand up. So you pull that bar out, put the walker in front, and they can step away and walk away. So you have a lot of value here. We've used it for slide transfers. We've used it for trunk control. We've laid it out and used it as a regular mat. We've used it as a stander, so as a standing assist, and also as a standing frame. So it's worked out really well. It's been real versatile. It doesn't take up a huge amount of space, so I just stuck in one more mat in my space, and now we're trying to figure out how we can afford it, get it in there, and get rid of one of the old high-lows that's not working anymore and replace it with something that's a lot more versatile, is going to give us a lot more help. The other thing that we found out, people questioned at first whether we were going to be able to interface it with a lifter, but the lifters went right under it. They go exactly as far as they need to. And this one, they actually brought the center back a little bit, so it'll go a little bit further under.